Sexual abuse has many symptoms, and as a child, many people do not realize what these symptoms are. Warning signs are not taught in school until children are older and more able to comprehend them. Many children begin being abused in single digits, and because the abuse is at a young age, they believe it's a misunderstanding since they have grown up with the abuse. In school, children are told that the only people who should be trusted are parents, significant others in the future, and medical doctors. Most of the coaches discussed should have been warning signs to parents, since a coach is not listed as someone who's allowed to touch gymnasts, though manipulation at a young age can con even the most helicopter parent. In my opinion, though, the worst sexual predator in USAG may have been, no doubt, the worst sexual predator in the sport and potentially in all professional sports history. Because this predator was a doctor and not a coach, he was able to use medical treatment to get away with molesting children. Given the fact that his treatment was a new treatment and not quite mainstream, he was able to persuade others in power to continue his treatment. Larry Nassar was shy and awkward as a child, according to friends and family. Nassar became interested in sports, like many of his family members who were all-star athletes. When Nassar tried out for various sports, he realized that he wasn't very athletic nor good. Like Nassar's older brother, Nassar became one of the high school's only athletic trainers. At the time, athletic trainers were not as common, and many schools did not have an athletic trainer for their sports. Still interested in sports, but not willing to play them, Nassar found this a fun way to stay in the sports field. Both boys had a lack of training, but weren't questioned because, again, at the time, athletic training wasn't widely considered in medicine and was still a new position in the field. Though Larry and his brother catered to all sports teams at the high school, Larry took a special interest in the gymnastics team. Gymnastics was becoming a more popular sport because of the success of Nadia, among many others. And Nassar found the sport fascinating. When Nassar graduated from high school, he was accepted into medical school at Michigan State University. While in school, he networked in the gymnastic community by volunteering as an athletic trainer to elite-level gyms. He was so committed to gymnastics that he would turn down entry-level paying jobs, with coaches believing that his calling was strictly in gymnastics and nowhere else. As he volunteered for elite-level gyms, he became more popular in the elite-level sport. In 1986, he became a physical therapist for USAG. At the beginning, Nassar studied under Jack Rockwell, former USAG trainer that was frequently interviewed in Little Girls in Pretty Boxes for exposing the toxic culture of coaches' abuse. Because physical therapy was still a growing profession in kinesiology, or the study of body movement, USAG did not require much experience and weren't upset that he was still in school since he would have a real degree in the coming years. In 1988, Nassar would begin working at John Geddards gym, Twistars, and in 1993, he would graduate medical school with a doctorate in osteopathic medicine. At the '96 Olympics, Nassar would become a familiar face when he would be promoted to National Medical Coordinator. He would be the first on the scene given the title and chaperone Kerri Strug off of the vault runway with Kelly Hill and Marta Caroli. With his short medical experience but upcoming popularity, many people ignored complaints of his practices because he was now an Olympic doctor. What is pelvic floor therapy? The pelvic floor muscles are located between the tailbone and the pubic bone within the pelvis. They support the bowel and bladder, as well as the uterus and vagina in females. Muscular bands, sphincters, encircle the urethra, vagina, and anus as they pass through the pelvic floor. The goal of the treatment is to improve the strength and function of the pelvic floor muscles and alleviate pain, weakness, and dysfunction in the muscles. During the treatment, a skilled physical therapist accesses the muscles through the rectum or vagina, and makes manipulations on them to improve their strength and functioning. This is done with sterile gloved hands by placing 1 or 2 fingers into the patient with firm consent. The therapist may either stretch the muscles if they are short and contracted, or apply resistance to improve strength if they are weak and dysfunctional. Treatments should be done only when consent is given, and should be as proactive and short as possible to ease pain and displeasure. It's not recommended for all adults, since depending on their condition, this therapy can make the recovery worse. According to Healthline, here are some examples that one would have pelvic floor therapy done: urinary leakage, lower back pain, constipation, difficulties with bowel movements or bowel leakage, difficulty emptying the bladder, or pain with sexual intercourse. As you can tell just based on these examples, normally adults get this treatment and not a child gymnast. Nassar was introduced to Philip Greenman while in graduate school. Greenman was widely accredited through the osteopathic community. Greenman would make many medical videos describing proper treatment. One included the pelvic floor. In Greenman's video, there is a warning at the beginning, since it is very controversial. The video describes proper hand placement and is only done on a fake model. Nassar became fascinated with the pelvic floor after watching this video. Classmates of his described that he discussed pelvic floor therapy often and found it almost helpful. Some people wondered why he didn't try other techniques. Classmates of his described that he discussed pelvic floor therapy often, and although helpful, some people wondered why he didn't try other techniques. When Nassar reached out to Greenman for more information on pelvic floor therapy, he stated to focus on the most important part of the pelvic floor, the sacrotuberous ligament. This ligament, which is located in the pelvic region, can be stretched with aggressive physical activity or injury. When harmed, the ligament can become thick and tight. It's common for the ligament to be harmed in sports that involve arching or twisting in the lower back. If this ligament is hurt, typically it is resolved with cross-friction massage or myofascial release. Myofascial release goal is to relax muscles by targeting myofascial tissue, which is located throughout the body. These tissues aid as a trigger point for pain. Typically, myofascial release is practiced in a chiropractic or massage center. However, Nassar used myofascial release and tried to connect his practice to treatment with the pelvic floor. He would state that the sacrotuberous ligament would need to be fixed because it controlled a lot of pressure points. He would use this ligament as a multi-purpose excuse to treat athletes, regardless of if the injury was related to this ligament or not. Larry Nassar would also use this treatment in a way to sexually abuse his patients. Nassar did not have much of an education in medicine before he began practicing, but he had enough to understand the basic of this treatment and that it should not be used on a child. Let's make this very clear that Greenman did not know what Nassar would do in the future with this treatment. Greenman is merely a victim in Nassar's manipulation. Because pelvic floor therapy was still new in the medical field at the time, many parents and coaches were unfamiliar with this therapy. Many coaches and parents got their education from Nassar, and although it sounded uncomfortable, they had to believe that Nassar knew what he was doing and had good intentions, since he had dedicated so many years to the program with success. As I said earlier, this is not a subject that should be taken lightly. When I researched this piece, I took many breaks from it, since it was emotionally draining. Watching the 22 hours of impact statements was exhausting to hear. All of the ways that he manipulated children was heartbreaking. So, I'd like to again warn those that what I'm about to discuss is very graphic detail with how he abused children. This is going to be a brief description because I'm just trying to get the main points out of how he got away with said treatment. I'm only using these examples for educational purposes and not for gratification. I removed many, many examples during my edits because it was repetitive and honestly either too graphic or not necessary to discuss. Like I said, this was not easy to research. I delayed it to the end of the project just because I knew how much time this would take and that I wanted to be in the right mindset to cover it. Nassar became an assistant professor at Michigan State University in 1997, shortly after graduating from the university with his doctorate. Now working at MSU as a teacher, he would also serve as a medical physician for the sports teams. Now treating children at a gymnastic club facility in Michigan, NCAA facility in Michigan, and National Gymnastics Organization, Nassar became a sports legend. This meant because of his long resume, he was able to persuade others into using his treatment, the pelvic floor therapy. Like I said earlier, this treatment should not have been used on children, especially for the short amount of time that he spends with most of his athletes. But as a predator, he showed many traits of being a great citizen. He showed many traits for somebody to believe he was a great citizen. Many successful predators are family and friends. They use tactics to groom the child into thinking that they care about their well-being. They may give the national gymnast candy at the ranch because it makes the gymnast think that he cares about their health since food was restricted. He may give the athletes at Twistars little gold pins from past Olympics that he worked at so they continue in the sport and not burn out. He may compliment other older gymnasts at MSU or allow them to vent about their frustrations on coaches to make them think that he cares about their mental health. Whichever audience he catered to, he made sure his manipulation reflected on the age level. Here are some examples of this. His first public abuse has been identified when he was still in school with family friends. His gymnastics abuse is documented as early as the late 1980s at Great Lakes Gym before he began at Twistars. His abuse at Twistars began as early as 1990, just 2 years after starting with the gym. His abuse in USAG is documented as far back as the early 1990s with Olympian Jamie Dancher in 1993. For MSU, the first complaint came out in 1998 but was neglected. I'm not really going to focus on MSU's poor handling since they are NCAA and this channel is primarily focused on USAG. Nassar would abuse gymnasts at MSU's training room, the Caroli Ranch and cabins, hotel rooms for away meets, at Twistars in a back room, and at his basement for down hours. Because the pelvic floor muscle can be touched anally or vaginally, Nassar would use both entrances to his advantage and without gloves. This led the gymnasts getting bacterial injuries like UTIs and bladder infections. Every race was affected, every childhood age was affected, even injury was treated under the guise of pelvic floor treatment. Some injuries in which would not have been resolved under pelvic floor treatment even if it was done correctly. These girls were not just gymnasts. They were also figure skaters, dancers, volleyball players, rhythmic gymnasts, track athletes, and beyond. Children were examined for ankle injuries, toe injuries, elbow, hip, arm, and beyond, and was told that the pelvic floor work therapy would treat this. Children were still confused because of basic anatomy. The pelvis is not related to those body parts since they are not directly attached to that tendon, muscle, ligament, or bone. The public also didn't realize the health complications that he refused to cure, leading children to worsening health problems. One child, now an adult, said that because he refused to treat her hip injury, that she has now gone hip replacement therapy at the age of 25 and is due for another one soon. She also suffers from young arthritis. Over the next few decades, many gymnasts and parents would try to report Nassar's questionable actions without success. One of the first to report this was Rachel Den Hollander. After the 1996 Olympics, Rachel would experience back pain while working out at a club-level gym. Referred to by the gym's receptionist, Rachel's mother took her to see Nassar. Larry made her mother comfortable by expressing his large background in sports medicine, asking, "Don't coaches at your gym have my book?" Asking how she got these injuries under her gym and how they could have been prevented if coaches read his advice on injury prevention. Nassar, hearing that she was having back problems, used it to molest her. When Rachel told her mom, the receptionist replied, "Well, it's a relatively new type of treatment. It's not comfortable, but it's better than a long-term injury." In another treatment memory, Nassar held out a model of the pelvis. "You see this?" referring to Rachel's mother. "This side of her pelvis is rotated." He again performed his sick treatment. "There, got it," he said. Her mother left, feeling more persuaded that Nassar knew what he was doing, but Rachel still left confused. When her mother had to reschedule an appointment, Rachel said that the new day wouldn't work because she would be on her period. Her mother was puzzled. Is he doing something internal? Eventually, Rachel told her mother that she was once groped at her breasts and penetrated at every treatment. When Rachel found out that a gymnast she was coaching was referred to by Nassar in the next couple of days, she reported his abuse to the coaches at her gym. The coaches continued to refer the gymnast, saying that nobody else had come forward about this treatment as a form of abuse, and that she clearly just misunderstood the treatment. Jamie Dancher stated that Larry would conduct breast exams during treatments and was molested while at the Sydney Olympics. Because of how investigations were done, USAG and the USOC had numerous investigations that didn't result in a charge. The Olympic sports legal market is dominated by a small number of attorneys and firms in Colorado Springs and Indianapolis, where most of the governing bodies are clustered. Victim advocates blame these lawyers and their emphasis on avoiding potential litigation that repeatedly arises during discussions of abuse prevention in Olympic sports. In 2011, the USOC started discussing a sex abuse prevention handbook, but there was problems with it. While several NGBs expressed that the handbook set the proper focus, there is also perception that publishing the handbook will increase their risk of legal liability, says Malia Arrington, a USOC executive in charge of abuse prevention. She wrote Blackman in a December 2011 memo made public by the USOC in communication with the Senate. Although people were coming forward about the abuse, parents and coaches would downplay it, thinking that the gymnasts were too immature to understand what he was doing. Typically, the abuse would happen when parents or coaches were in the room, making them believe that abuse would only happen behind closed doors when an adult is not around. In theory, many coaches and parents were in the room when this happened. Typically, the gymnast was required to wear loose-fitted shorts because it was easier access into the vagina or anus. A towel was used to cover up the genital area, or Nassar's body was positioned just right to cover up his treatments so that coaches or parents could not see the child being molested. One parent, like many, questioned his abuse when he closed his eyes during treatment. When she asked Nassar why he closed his eyes, he said that it was to help him concentrate better. How could she have known it was for sexual gratification? This abuse would go on for decades, and the pattern would continue. Children would be molested, they would tell someone, and it would be either neglected because they didn't want to believe it, or because they honestly didn't believe the child. Police in Michigan investigated Nassar twice. One inquiry from 2004 concluded that his actions were not medically appropriate. Another investigation in 2014 and 2015 did not result in charges. But all of this would change in 2015. Why did coaches not speak up? Well, that's a great question that is rather complex. We know that, of course, many elite coaches, like Donna Strauss, were toxic people that valued success more than a gymnast's well-being. And although some of them, like Marta Caroli, knew of his abuse, they refused to report it. And this is because Nassar would clear gymnasts early to compete because they had a political affiliation agreement with USAG, and because Nassar was so good at persuading coaches that he was a good guy with a long reputation. Many coaches like Mary Lee Tracy trusted him and him only. So people like her downplayed any accusations against him because he was a medical Olympic doctor, and the child was merely a child with no background in sports medicine. This scandal was a project that I've spent months formulating. The scandal has also opened up a large discussion on athlete safety and sexual abuse signs, how to report abuse, and how USAG handled its abuse. Because there's so much that has happened in over a decade, I provided a timeline of these events that have taken place regarding Nassar.